The journey begins many times by meeting the family prenatally. A diagnosis of cleft lip in the infant can be made as early as 20 weeks gestation.
The nurse's job is to explore the causes of cleft lip and palate, relieve the family of any feelings of guilt or blame, discuss the care of the infant, and what kind of support systems are in place. For example, whether family and friends are available to help out. You also want to find out where the baby will be born so you can contact the hospital or NICU to work through any issues connected to the infant. The last thing is to connect the parents to other families, websites, Facebook, and give them helpful written material.
Very beautiful. So today I wanted to do her physical exam, give her a head-to-toe exam, and make sure that everything is okay.
Great.
So we're going to put her up on the table, and I'm going to get her undressed.
Okay.
I'm going to start up at her head. She's got an awful lot of hair. And I'm going to feel for her soft spot, the anterior fontanelle, which is, all babies have that, and it gives you a good sense that she's nicely hydrated and definitely taking in enough fluids because her soft spot is nice and soft here.
Oh, I didn't know that.
Yeah.
Interesting.
I'm going to measure her head circumference real quick. She looks like she's a totally appropriate size for a newborn being 2 weeks. She's got a great startle reflex. I'm going to check her head size. So 38, very good. And I know that she already had her height and weight. Okay. What Lulu has, like people have told you, is a left unilateral complete cleft lip and palate. Okay. I'm going to get a look inside her mouth, but everything in there looks really nice and moist. Her face looks totally normal and symmetrical. And now I'm going to take a listen to her heart and her lungs. Heart defects can sometimes occur in newborn babies, and that's why it's important to take a listen to her heart and make sure that she doesn't have any murmurs. She's breathing very easily, so I know that her breathing is fine. I'm going to take a look at her hands. Her hands look perfect. Sometimes babies can be born with, an extra digit. Now I'm going to feel her belly. And her belly really looks nice and soft. She looks like she's getting hungry. And we can feel the belly to make sure that none of the organs are enlarged. I'm going to undo her diaper quick so I can check her pulses in her groin and check her hips real quick to make sure that her hips are in place. I'm just going to check her hips. Okay. And what we feel for is a feeling of a click or some kind of a noise, but she doesn't have any of that. Next, we're just going to check her feet, and her feet look perfect. And then the last thing I'm going to do is flip her over real quick and just check out her spine. Sometimes babies can be born with what we call a sacral dimple. It's right at the base of her spine. Very rarely does it mean anything, even if a baby has one.
Okay.
But sometimes we will want to get an ultrasound if we see a little dimple there. But Lulu does not have one at all. So she is perfect. So I think she's all set.
All right, so we're going to continue the newborn observation, and we're going to look at a couple of other things that she will be giving you cues as to what she needs from you. So to start, what we're going to do is actually put her back on the table, and we're going to look at her response to how much support she needs when she's being held. So what we're going to do is pull her from a laying position into a sitting position. Now, you wouldn't usually do this with an infant because their heads are a little floppy, but what that's going to tell us, if she's not able to sort of support herself, that she needs a little bit of extra support when she's being handled.
Okay.
So that will be the first, and then the second, what we're going to do is put her on her belly and see her response. If she starts to crawl and swim like a baby would on her belly, what that's going to tell us is that she's able to safely sleep and also safely be on her belly for tummy time.
I see.
Another thing we're going to look at too is we're going to look at her hand grasp. Another thing we're watching this whole time is how she soothes herself. So she's a very good self-soother. She was crying a little bit there, and right away she started to soothe herself. So she's not hysterical, and she's able to calm herself. So we're also going to look at her rooting reflex too. So we're going to see how hungry she is. So if you stimulate the cheek here, she should automatically start to turn towards that stimulation, looking for the breast to feed. We're going to call her. I'm going to have you call her name.
Lulu.
We're going to see how she does turn.
Lulu. Do you hear Mom?
So making pretty strong eye contact with me. Hi. Good job. So when she disengages from eye contact, she's telling us I'm overstimulated and I don't want to socialize right now.
Okay.
Whereas if she looks straight into your eyes, Hi. Hello.
The baby is going to use the anatomy that she has. She has a normal tongue, normal lower gum, and a normal upper gum on her right side. So we want to be able to place this nipple in between those two gums and over her tongue so that she can use what she has to compress the nipple. So you want to stimulate her to eat. You don't want to stimulate any kind of a gag. Sometimes you can actually put your finger in the mouth to get her.
Yeah.
There we go. Oh, there, she's sucking right away in my finger. All right, now push the chin down. And she's going to lay the nipple on top of the tongue. Don't squeeze yet. And there she goes. So she's got a beautiful suck-swallow rhythm.
Other factors that may affect feeding the newborn could be prematurity, cardiac condition, respiratory distress, other syndromes, or craniofacial anomalies such as Treacher-Collins syndrome, Crouzon, Apert syndrome, hemifacial microsomia, or Robin sequence. It's important for the nurse to ask about the psychosocial concerns of the parents and family. How are the parents responding to their child? How do they feel about the baby's cleft? Do they have any financial issues or transportation difficulties?
If the parents are able to nurture their infant, then it will be easier to provide nourishment to their infant.